blood supply of the upper limb is through the axillary artery and its branches. Axillary artery begins at the lateral border of first rib as the continuation of subclavian artery and terminates as brachial artery at the inferior border of teres major muscle. Axillary artery divides into the three parts by pectoralis minor, and each part has corresponding branches. The first part of the axillary artery is located between the lateral border of the first rib and the medial border of the pectoralis minor. It is enclosed in the axillary sheath and has one branch, which is the superior thoracic artery. The second part of the axillary artery is found posterior to pectoralis minor and has two branches. These are thoracoacromial and lateral thoracic arteries. The third part of the axillary artery lies between the lateral border of pectoralis minor and inferior border of teres major and has three branches. These branches are the subscapular, the anterior circumflex humeral, and posterior circumflex humeral arteries. The subscapular artery is the largest branch of the axillary artery. The axillary artery and its branches supply the axilla, part of the intercostal spaces, breasts, and proximal part of the upper limb. The branches of the axillary artery have corresponding veins that accompanying the arteries. The veins are more prominent than arteries and frequently anastomosed with one another and other veins. This anastomosis forms a collateral route that enables venous return in the presence of obstruction of the inferior vena cava. For example, the thoracoepigastric veins are formed by the anastomosis of superficial veins from the inguinal region with lateral thoracic vein. The axillary vein is formed by the union of the brachial vein and the basilic vein at the inferior border of the teres major. It continues at the lateral border of the first rib as subclavian vein. If this video is helpful, consider subscribing or clicking the like button.